Hi there. Welcome to Hersco Online, where we look at tips and ideas for making custom foot orthotics, custom shoes, and AFOs in these short educational videos. In this segment, we're going to look at designing custom foot orthotics. From the outset, the three most critical pieces of information, besides the patient's diagnosis and their prescription, are their weight, their lifestyle, and their shoe style. In order to design the correct custom foot orthotic for the patient, we need to have these three pieces of information. This information may have the least to do with the patient's prescription or even their biomechanical evaluation, but the entire success of the orthotic may well depend on the three factors: the weight, the lifestyle, and the shoe style. Let's take a look at each one. These are in step 1 on the flowchart. The patient's weight is the most critical piece of information that you can give the lab if they're going to design the proper foot orthotic and use the right material. For example, a soft durometer EVA, such as a 35 Shore hardness EVA, may work well for an older lady who's 125 pounds, but the same orthotic designed for a truck driver who's 250 pounds will need to be made of something firmer, such as thermocork, 55 durometer. The bigger the shoe, the thicker the plastic needs to be in order to retain its flexural strength. And finally, the shoe style itself is important. Is the orthotic going into a laced shoe, a sneaker, or a work boot? If the patient is a professional and they're wearing dress shoes during the day, the orthotic will need to fit inside those tighter fitting shoes. On the other hand, a patient who's an athlete, someone who's perhaps training for the marathon, will typically only want the orthotic to work in their sneakers. You have more room and more choices in those situations. Ask the patient what they use the orthotic for most and what kind of shoes they typically wear. And don't be fooled by what they wear when you see them in the office. Personally, I think it's great if you have 2 pairs of orthotics, or even more. One for your dress shoes and one for your sneakers. That way, you always have the right orthotic in the appropriate footwear. One thing is certain: if the orthotic is not worn inside the shoes that the patient usually wears, it will not do them any good sitting in a closet. The first office visit is your best opportunity for patient education. That is the time when they're most likely to listen to you, considering the fact that they're usually in pain. They need to consider getting the right pair of shoes for your foot orthotic to work. I recommend wearing firm, stable shoes, usually with a removable inlay, so there's room for the orthotic to fit in there. And typically I suggest that they wait until they have the new orthotics before they buy the next pair of shoes. And finally, a top tip: anytime the patient has an existing foot orthotic that's working for them, or they have a shoe with a removable inlay, remove the insert or the orthotic and then trace it so that you can give the lab the outline of exactly what's working for them at the moment. If you give the lab the outline of an existing insole, they can trim the orthotic to exactly fit the shoe. That way you'll not need to make any adjustments once you receive it back from the lab. For these tips and further ideas on designing custom foot orthotics, please visit our website at hersco.com and click on the Educational tab. The article there is called Designing Custom Foot Orthotics. My name is Seamus Kennedy. Thank you for watching Hersco Online.